And we'll have more on the flood situation a little later.
In Victoria and Queensland, health officials say there's a high risk of gastrointestinal diseases from the floodwaters and mosquito-borne diseases from the stagnant water that will follow the floods. People are being urged to keep their skin clean and dispose of contaminated food. Andrew Laming is the member for Bowman in Queensland, and he's the opposition spokesman on regional health services. And he joins me now from our Adelaide studios. Thanks for joining Afternoon Live. What are the range of health problems that we're seeing in Queensland as a result of the floods?
Well, there's effectively three challenges, Bridget. The first is a challenge we've already seen in Rockhampton where the floods arrived last week, and that is the gastrointestinal disease, and warning people to be extremely cautious about food and water. The second one, of course, is around minor cuts and abrasions, and we've seen constant reminders about that. But what really threw everything in the air was Mayor Campbell-Newman's decision to have this enormous working bee of volunteers. We had 15,000 people out on Saturday and Sunday cleaning up the city, and so that means that on what is effectively the flood battlefront, we have not highly trained SES workers, but we have well-meaning volunteers who are in many cases inadequately prepared for that work.
When you say inadequately prepared, in what sense? Can you give us an example?
The two most important examples of all would be to wear adequate gloves. We need heavy-duty gloves, not washing-up gloves that you pick up from underneath the kitchen sink. And secondly, we need heavy-duty boots for wading around these areas, and ones that in particular are non-skid so that one doesn't slide over in those very perilous and slippery conditions. What we saw on the weekend, of course, was a big surprise for public health experts, because with 10,000 people moving around and falling over, we had in many cases 20 people per hour presenting at accident and emergency centres throughout Brisbane. Many of them had serious lacerations and had suffered falls. And what it made obvious was that the public health warnings were not adequate and were not keeping up with the flood situation. There was from Queensland Health flood warning and health recommendations December 29. They were then repeated January 14, but in between they were not updated significantly. The great problem with these warnings are they have to be simple, they have to be comprehensive, and they have to be accessible. And in many cases, you read these recommendations, you're more confused than if you hadn't read them at all.
I suppose, though, that Campbell-Newman and the Premier would argue that they did try and give warnings to people. You know, I heard a number of times about volunteers about wearing proper clothing, but when you've got 10 to 15,000 volunteers, can there be enough warnings, particularly because they came in so quickly?
We know there's going to be an enormous challenge here, no doubt about it, and the authorities are doing a great job. But let's be honest, we need to have heavy-duty gloves available to people if they want to work in these areas. That should be a bare minimum. The other concern is that the recommendations are saying if you are injured, you simply put a waterproof bandage on and head back in to the scenario. Well, I believe that's inappropriate. I think also it's not good enough for health authorities to say phone 13 Health for non-life-threatening emergencies. This is the first health crisis where people aren't urged to seek medical attention and to go to a general practitioner or the hospital. It's a fallacy to think that these areas are overrun. In many cases, hospitals are on call and ready to look after these sorts of injuries.
Are the hospitals and medical centres that you're talking to under pressure?
They would report that in the acute phase, in fact, everything's blocked off, so no one can get to the hospital. But then they cater for that and they call in extra staff and they're ready to go. I think that while the 13 Health number is appropriate to phone a nurse for advice, where you have a significant injury, there's potentially infected, there's no doubt it needs to be seen. I don't think we need to be phoning 13 numbers in those situations. We should be saying to people that these are extremely toxic areas and you should be seeking medical attention immediately. The great problem is that when you're surrounded with this form of suffering and disruption, the temptation for heroics is almost irresistible. It's not a time for heroics. We have plenty of time to have medical assessments of these injuries, and to be honest, in most cases it means leaving the area, having it properly and professionally treated, and in fact if it's a laceration of the lower limb, it means elevating it and resting it, not going back in.
Like Kevin Rudd, he's a good example. He went to hospital, he ended up in hospital with an infection in his leg because of a cut.
Well, we had a celebrity exemplar there, and I'm not sure that he called 13 Health. I think he went straight to hospital, which was the right thing to do. But there's also the other issue we haven't touched on, and that is the food poisoning issue. It's way too confusing when you read health recommendations from Queensland Health, because they're giving 3 different pieces of advice in the one document. And in one part they're actually saying that food that has been defrosted for 36 hours without ice being added to fridges and freezers should be eaten immediately. Now that's simply not right. We don't want people taking chances, and this food in a subtropical climate should be discarded immediately.
Yeah, I had heard from Campbell Newman and Anna Bligh that when people go back into their houses, any food that's been in the fridge or freezer, throw it out. And that's what they're wanting to, because they don't want rats and food poisoning. What about things like if people in their kitchens have had canned food that's been in their cupboards, the cupboards have been flooded? Can that be kept?
Well, canned food typically can be because it's completely sealed, but you make a very good point. Floodwaters simply can raise moisture levels such that the risk of mould infection is also significant. Food can look okay, but actually be no good. And you need to remember there are two very important situations here. We're a wealthy country. We can afford to throw out food that we're uncertain about in a high-risk situation like this. And number two, food supply is adequate. Many of the recommendations, if you look at what Queensland Health is putting out, are appropriate for emergency situations where supplies have been completely cut off. It's not the case. We can deliver perishable foods to almost all these locations, so we're urging people, don't take chances. A recommendation that says if food is smelly or slimy or you have any doubt, throw it out, it almost invites people to say the food was neither smelly nor slimy, so I kept it. Please, no risks. There are 70,000 households that lost power for 36 hours or more. There are 25,000 that have had no power since Wednesday of last week. There are 2,500 down in the Lockyer Valley that have had no power since Monday, and it should not be an issue for debate. It should be one of completely throwing out all of those perishables and starting again.
Andrew Laming, we'll leave it there, but thank you very much for joining us.
You're welcome.
Well, the Queensland Premier